Hi, everybody. So today we're going to talk about human development, which occurs to the biological, psychological, and social changes that happen throughout a person's life. So from the moment we're conceived to our last breath, we're constantly growing, changing, and adapting. And here is our objectives for this lesson. So when we talk about human development, life is a biological process that never stops. So, even though we may not always notice, our bodies and our minds are constantly undergoing changes. And these changes can be physical, such as, when we grow in height and weight. It can be cognitive, like learning new skills and developing memory. And even as adults, we continue to evolve and our cells regenerate and our experiences shape our perspectives and our abilities change with time. So scientists and researchers have divided human development into different stages, and we're going to talk about each of these stages. So, such as infancy, childhood, adolescence, adulthood, and old age. And these labels are not strict categories. Rather, they just help us to better understand how humans grow and change over time. And by studying these development and stages, we can predict certain milestones and recognize challenges at different ages and better support health and well-being. So now let's take a closer look at the prenatal period. So this is um, the very first stage of human development. And this phase begins at conception and it continues until birth. And it's during this time that the foundation for all future growth and development is established. So it's really important to know what is going on during pregnancy and during this period because it will affect that baby or that person's life. So the prenatal period is a critical stage of development, and that's where that single cell grows and transforms into a fully formed baby in 9 months. So this period is divided into three main stages. You have your uh, germinal stage, which is weeks 1 and 2. Some of this might be repeat from your other class that you're learning as well this semester. Then you have your embryonic stage, which is weeks 3 to 8. And that's where the embryo develops the essential structures like the brain, heart, spinal cord, major organs begin forming. And then you have your fetal stage, which is weeks 9 until birth. And that's when the fetus grows rapidly, gains weight, and then develops features like fingers and toes and things like that. So, the study of how a baby develops before birth is called embryology. And embryologists study the complex process of how a fertilized eggs grow into human beings. So, um, this is when they look at how life starts as just a single microscopic cell. And then within just a few months, it develops into a baby with a beating heart, working organs, and even the ability to respond to sounds. And pregnancy is, how long does it last? It's about 39 weeks. All right, so what happens right immediately after conception? And so the journey from fertilization to implantation, it's a really critical early stage of human development where that single fertilized cell rapidly multiplies and prepares to attach to the uterus. So the timeline of fertilization to implantation. So the process from fertilization to implantation takes about 10 days and it happens in several different steps. So fertilization happens in the outer third of the oviduct, and this is the fallopian tube that connects the ovary to the uterus. Once that egg is fertilized by sperm, it forms a zygote, which is the first stage of human life. The zygote is already genetically complete, so it contains all the DNA needed to determine eye color, height, even personality tendencies. So at this stage, the zygote is a single cell, but immediately starts dividing rapidly. And about 3 days after fertilization, the zygote has divided multiple times and it forms a solid ball of cells that's called a morula. And then morula continues to move down the fallopian tube towards the uterus. So during this time, the morula receives nourishment from surrounding fluids, and it's preparing for the next stage, which is implantation. So in this slide, um, you can see these pictures are figure 24-1 in your book, and it shows fertilization. So we're looking at that process of fertilization, which is that first step, right? So this is when a sperm cell from the father and an egg or an ovum from the mother combine to create life. And again, this fertilization, when the sperm cell successfully penetrates the outer layer of the ovum or the egg, that happens in the fallopian tube within 24 hours after ovulation. Only one sperm out of the millions will successfully reach and fuse with the egg. And once that sperm enters, it releases its genetic material or DNA into the egg, and it combines with the egg's DNA to form the zygote. So, and then you see on the left, we still see an illustration of fertilization. So the sperm cells are shown surrounding the ovum, trying to penetrate it. And you can see some of the key structures here, like cytoplasm, which that's a jelly-like substance inside the egg where cellular processes occur. Then you have a nucleus, which contains the egg's genetic material. And then you also see the sperm cell, which is delivers the DNA from the sperm. All right, in this slide, we're looking at the journey of the fertilized egg or the zygote as it moves from the fallopian tube to the uterus for implantation. And this is essential for pregnancy to actually be successful and to begin, right? So fertilization happens in the fallopian tube where the sperm meets the egg to create the zygote. And then that zygote immediately starts dividing and it undergoes a process called mitosis, which means one cell becomes two, then four, then eight. So just multiplying really rapidly. And then as it travels, it transforms into a morula, which is that solid ball of cells. And then eventually it's going to turn into blastocyst, which is a hollow structure that's ready for implantation. And that fallopian tube, it acts as the passageway to help guide that fertilized egg towards the uterus. And then implantation happens when the blastocyst reaches the uterus and attaches to the uterine wall. And again, that's a really crucial step because it allows the embryo to receive nutrients and oxygen from the mother. All right, so now we've talked about fertilization and implantation. Now we're going to focus on that blastocyst stage. So this is a crucial phase in the early development, and it sets the stage or the foundation for the formation of the placenta, the amniotic sac, and embryo. So after fertilization, the zygote undergoes, again, those multiple cell divisions and forms that morula. And as that division continues, that morula changes into a blastocyst, which again is a hollow ball of cells with an inner fluid-filled space. And this transition happens around 4 to 5 days after fertilization and is preparing the blastocyst for implantation. By day 10 after fertilization, the blastocyst reaches the uterus and implants onto the uterine wall. And implantation is crucial because it secures the developing embryo inside the uterus and allows for nutrition and oxygen exchange. If it doesn't do this, then the embryo is not going to get the nutrients and oxygen that it needs, and it won't survive, and that pregnancy won't continue. So this blastocyst, it plays a really important role in forming protective and supportive structures like the amniotic cavity, which becomes that fluid-filled sac that cushions and protects the embryo, and the chorion, which develops into the placenta. And the placenta is an essential organ that helps provide the oxygen and nutrients, and it also removes waste from the growing fetus. So the placenta is a temporary but very important life-saving organ that connects the baby to the mother's blood supply. All right, so now that we've seen how the blastocyst forms in implants, let's take a look at what happens after implantation and how the early embryo begins developing into more complex structures. So once the blastocyst reaches the uterus, it's most successfully attaches to the uterine lining to continue developing. So that outer layer of the blastocyst is called the trophoblast, and that plays an important role in this process. It keeps the blastocyst attached and burrow into the uterine wall. And this attachment allows the blastocyst to start receiving those nutrients and oxygen from the mother. So after implantation, several important structures begin forming, and you can see them in this diagram. So you'll see the inner cell mass, which is a group of cells inside the blastocyst, will eventually become the embryo. You have a yolk sac, and that provides early nutrients before the placenta is fully functional. You have your amniotic cavity, which is that fluid-filled sac that protects the embryo as it grows. And then you have a developing chorion, which forms part of the placenta, and it allows that nutrient exchange between the mother and the baby. So as the implanted blastocyst develops, it forms the embryonic disc, which will later give rise to all the major organs and body systems within the baby. And the uterine glands and blood vessels surrounding that embryo help to ensure that it gets the oxygen and nutrients that it needs for its growth, because it's, again, growing very rapidly. And by the end of this stage, the foundation for major body structures is being laid out. And this is, you can look at this at figure 24-4 in your book. And now that we've covered implantation and early development, let's break down the prenatal periods of development. So pregnancy lasts about 39 weeks. And during this period, the developing human goes through two major stages. You have the embryonic phase and the fetal phase. So the average pregnancy, again, lasts around 39 weeks, is measured from the first day of the mother's last menstrual period. And this time is divided into trimesters. But from a developmental perspective, we classify it into the embryonic and fetal stages. So the embryonic phase starts around week 3 after fertilization, and it lasts until the end of week 8. And during this phase is when major organs and body systems begin to form. The embryo develops a neural tube, which becomes the brain and the spinal cord, and the heart starts beating around week 4. And this is the most critical stage of development because any damage from harmful substances like alcohol, drugs, infections, medications, any environmental toxins can cause serious birth defects during this stage. After week 8, the developing baby is called a fetus. And during this phase, organs and body systems continue to mature and grow. The fetus starts moving, and by the second semester, the mother can feel the baby kicking. And by the 3rd trimester, the lungs are developed and the baby prepares for birth. So this phase is focused on growth and refinement, and it ensures the baby's ready for survival outside the womb. So here's a couple of questions to think about. So how does the embryo receive nutrients before the placenta is functional? Right, so before the placenta is fully developed, the ovum relies on the stored nutrients to support cell division from the fertilized ovum to the blastocyst stage. And then we talked about the functions of the placenta, but it is the lifeline for the developing baby. It anchors the fetus to the uterus. It acts as a bridge for exchanging nutrients and waste between mother and baby. And it functions as excretory, respiratory, and endocrine organ to help regulate the baby's development. The placenta is composed of maternal blood. It's a very thin layer of placental tissue, and it separates the maternal blood from the fetal blood and makes sure that they don't mix. Okay, in this slide, we look more at the placenta because it is so important for the developing fetus. And the placenta ensures that the baby receives, again, oxygen, nutrients, and protection while also removing those waste products. So the placenta is a temporary organ that forms during pregnancy and serves multiple functions. Again, it anchors the fetus to the uterine wall. It transfers oxygen and nutrients from the mother to the baby, and it removes waste products from fetal circulation. And it produces hormones to support the pregnancy. Without the placenta, the fetus would not be able to grow or survive. So this diagram on the left illustrates how the maternal and fetal blood systems interact without mixing. So oxygen-rich blood from the mother flows through the maternal arteries into the placenta's lucinae, which is the space filled with maternal blood. The chorionic villi are tiny structures in the placenta that allow nutrients and oxygen to pass from the mother's blood into the fetal blood vessels. And this fetal circulatory system is connected to the placenta via the umbilical cord, which contains the umbilical vein, which carries oxygenated blood to the fetus, and the umbilical arteries, which carry deoxygenated blood away from the fetus back to the placenta. Then waste products from the fetus, like carbon dioxide, pass through the placenta and enter the mother's bloodstream so that it can be removed. And although the placenta allows nutrients and oxygen to pass, maternal and fetal blood do not mix. It is a very thin layer of placental tissue that separates the two blood supplies, and this helps to protect the fetus from harmful substances. However, some substances can cross that barrier, and so Beneficial substances are going to be oxygen, nutrients, antibodies that help protect the baby from infections, but harmful substances could be alcohol, nicotine, certain drugs, and viruses like rubella, which can cause birth defects or developmental issues. The image on the right shows an actual placenta after birth. The umbilical cord is visible there, connecting the baby to the placenta. The dark red areas show where the maternal blood circulated, and the branch-like structures show the chorionic villi that facilitated the nutrient exchange. And you can see these are figure 24-5 in your book. So as the embryo continues developing after implantation, it begins forming 3 primary germ layers. So these layers are essential because they give rise to all the body's organs and tissues. And understanding these layers help us see how complex structures form from simple cells. So by the end of week 2 to week 3 of development, the embryo organizes into 3 distinct layers. You have the endoderm, which is the inner layer and forms the lining of the digestive tract, liver, pancreas, and lungs. You have the mesoderm, which is the middle layer and develops into muscles, bones, the heart, kidneys, and blood vessels. You have ectoderm, which is the outer layer, and it forms the skin, hair, nails, and nervous system, and it includes the brain and spinal cord. And each layer plays a really unique role in forming those different parts of the body. And it ensures that by month 4, all major organ systems are developed and functioning. So at this stage, the embryo contains stem cells, which are those unspecialized cells that are capable of transforming into specific cell types. So stem cells are crucial because they create specialized tissues such as nerve cells, muscle cells, and skin cells. All right, this slide shows an image of human embryos and fetuses at different stages of development. And as the embryo grows, it gradually transforms into a recognizable human form that has developed vital organs and body structures. So you can see this is figure 24-6 in your book. When we look at number A, that's at 35 days. B, right below it, is at 49 days. C is at the end of the first trimester, and D is at 4 months. All right, so now we've discussed the primary germ layers. Let's look at histogenesis and organogenesis. And this is the processes that transform those layers into those specialized tissues and organs of the body. So organogenesis is the process by which organs develop from the 3 primary germ layers. So each germ layer gives rise to specific structures. Again, the ectoderm forms the nervous system, skin, and sensory organs. The mesoderm develops into muscles, bones, heart, and blood vessels. And the endoderm becomes the digestive tract, lungs, and liver. And this stage is crucial because any disruptions can lead to congenital abnormalities or birth defects. Histogenesis is the process where cells differentiate into specialized tissues like muscle, bone, or nerve cells. So this includes cell differentiation, so cells that take on unique functions, cell multiplication, which is the rapid division, which increases tissue size. You have tissue rearrangement, which is cells organized into complex structures. And these processes allow the organs to function properly as the fetus grows. And by the 4th month of gestation, most organs are already formed. And from this point until birth, development is primarily focused on growth and maturation. So, for example, the lungs develop to prepare for breathing. The brain forms more connections for sensory processing. The bones harden and fat accumulates to regulate body temperature after birth. And this slide highlights the critical periods of neonatal development. It shows when different organ systems form and when they're most vulnerable to harmful influences. And those harmful influences are called teratogens. And this would include drugs, alcohol, or infections. So understanding these crucial windows help us recognize the importance of prenatal care. So this chart breaks down development into 3 major phases. You have the pre-embryonic period, which is weeks 1 and 2. And this is when the fertilized egg undergoes that rapid division. So any severe disruption at this stage usually leads to spontaneous abortion or miscarriage. Then you have embryonic period, which are weeks 3 through 8. And this is when major organs and structures form, making it the most critical period for birth defects if exposed to harmful substances. And then you have your fetal period, which is weeks 9 through 38. And this is when growth and refinement of structures occur, but teratogens at this stage are more likely to cause functional defects rather than major structural abnormalities. So the red areas represent the times when major birth defects are most likely to occur if the embryo is exposed to teratogens. The yellow area indicates periods where minor birth defects are more likely, and the numbers refer to weeks of gestation, showing when different organs develop and when they are most vulnerable. So as the baby completes its development around week 39, the body begins preparing for birth, and this is a process known as parturition. And this slide outlines the key steps involved in labor and delivery. So at the end of the pregnancy, the uterus becomes irritable, meaning it starts having Braxton Hicks contractions, which is mild practice contractions leading up to real labor. The fetus moves into a head down position and starts pressing against the cervix in preparation for birth. And this position is ideal for a smoother delivery. And then the stages of labor, you have contractions that begin. Labor officially starts when regular contractions occur, and these contractions help to push the baby downward. You have the rupture of the amniotic sac, which is your water breaking. And that amniotic sac surrounding the baby ruptures, releasing fluid. And again, that's known as the mother's water breaking. Then you have the cervix, which must dilate or open to about 10 centimeters to allow the baby to pass through. And then once the cervix is fully dilated, the baby moves through the birth canal and is delivered. And this is just a figure 24-8 in your book that shows this process. Time required for vaginal birth varies widely, but it could be anywhere from 6 to 25 hours. So labor is divided into 3 main stages, with some clinicians also recognizing a 4th recovery stage. The stage plays a crucial role in ensuring a safe delivery for both mother and baby. So stage 1, which is dilation of the cervix, this is the longest stage of labor, and it can last anywhere from 6 to 12 hours or more for first-time mothers. It begins with regular contractions and ends when the cervix is fully dilated to 10 centimeters. With early labor, contractions start mild and irregular, and the cervix dilates to around 3 centimeters. Active labor is when contractions become stronger and closer together, and the cervix dilates from 4 to 7 centimeters. And then the transition phase is the most intense stage, and that's where the cervix dilates from 8 to 10 and signals that the body's ready for delivery. Then for stage 2, which delivery of the baby, that stage begins when the cervix is fully dilated and ends when the baby is born. So it usually lasts 30 minutes to 2 hours, but it can be shorter in mothers who had previously given birth. The mother pushes with each contraction to help move that baby through the birth canal. And once the baby's head emerges or crowning, the doctor or midwife assist with the rest of the delivery. Then in stage 3, which is the delivery of the placenta. So after the baby's born, the uterus continues contracting to detach and expel the placenta. And this process usually happens within 5 to 30 minutes after the birth. And doctors ensure that the entire placenta is removed, as if there's any retained tissue, it could cause complications. And then stage 4 is that recovery period. And some clinicians recognize if this fourth stage, which is the immediate recovery period within the first 1 to 2 hours after birth. And during this time is when the uterus contracts to prevent excessive bleeding. The mother and baby begin skin-to-skin contact to promote bonding and breastfeeding. So after birth, medical professionals assess the new baby's health using an APGAR score, and in some cases, delivery is performed through a C-section or cesarean section instead of a vaginal birth. So we're going to talk about those two things. So the APGAR score is a quick health assessment that's done at 1 minute and 5 minutes after birth to evaluate the baby's overall condition. It helps determine whether the baby needs immediate medical attention or additional monitoring. So APGAR stands for A, appearance, which is skin color, P, which is pulse or heart rate, G is grimace or reflex response, A is activity or muscle tone, and R is respiration for breathing effort. So each category is scored from 0 to 2 points with a maximum possible score of 10. So 7 to 10 is a healthy baby. 4 to 6 may need assistance with breathing or other interventions. And 0 to 3 requires emergency medical attention. So a cesarean section or C-section is a surgical procedure used to deliver a baby when vaginal birth is not possible or safe. And it involves making an incision in the abdomen and uterus to safely remove the baby. So some reasons for a C-section may be fetal distress, maybe the baby's heart rate is too high or too low, a breech position, which is when the baby is feet first instead of head down, placenta previa, which is when the placenta is blocking the birth canal, multiple births like twins or triplets or more, or emergency situations like umbilical cord problems or maternal health risks. So C-sections are major surgeries and require longer recovery compared to vaginal births. Many incisions required in a cesarean section, a C-section, it requires 2. So an incision through the abdominal wall and an incision through the uterine wall. So this is why recovery is much slower. So sometimes a pregnancy results in the birth of 2 or more infants, known as multiple births, and it can happen in different ways that lead to either identical or fraternal siblings. So identical twins or monozygotic monozygotic occur when a single fertilized egg or zygote splits into two embryos. So these twins have the exact same DNA, meaning they share identical genetic traits, including eye color, hair type, blood type. Since they come from the same zygote, they're always the same sex, both boys or both girls. Fraternal twins, or dizygotic, develop when two separate eggs are fertilized by two different sperm. So these twins are no more genetically similar than regular siblings, and they can be of the same or different sexes. Fraternal twins run in families, as some women naturally release multiple eggs during ovulation. Triplets, quadruplets, and more can occur in two ways. So multiple zygotes got fertilized at the same time, which is fraternal, or a single zygote split into multiple embryos, which is identical. Um, Advancements in fertility treatments, such as in vitro fertilization or IVF, have increased the chances of multiple births. Twins can be classified into two main types. We talked about monozygotic, which is identical twins, or dizygotic, which is fraternal twins. So these two types of twins form in completely different ways and have unique genetic similarities and differences. So monozygotic twins occur again when a single fertilized egg or zygote splits into two embryos during early development. Since they come from the same egg and sperm, they share 100% of the same genetic material. So characteristics of identical twins, always the same sex, either both male or both female, have identical DNA, but may have small differences due to environmental factors. They share physical traits like eye color, hair type, and blood type, and it occurs randomly and is not inherited. With dizygotic twins, this results from the fertilization of two separate eggs by two different sperm. And since they come from two different ova, they are genetically unique, just like regular siblings. So some characteristics of fraternal twins is they can be either the same or different sexes. So boy-girl twins are always fraternal. They share about 50% of their DNA, just like any other siblings. They often look different from each other and more common in families with a history of multiple births, as some women naturally release more than one egg per cycle. The likelihood of identical twins is random, but fraternal twins can be influenced by genetics. Like if you have a family history of fraternal twins, that increases the chance of multiple ovulations. Age, so women over 35 are more likely to release multiple eggs. And fertility treatments like IVF and ovulation stimulating drugs increase the chance of fraternal twins. So while pregnancy is usually a smooth process, complications can sometimes occur, particularly related to implantation and the placenta. And so we're going to talk about those. There's three major conditions that can affect pregnancy. So one is ectopic pregnancy, placenta previa, and abruptio placentae. So ectopic pregnancy occurs when the fertilized egg implants outside the uterus. This is most commonly in the fallopian tube. And since the fallopian tube cannot support a growing embryo, this condition is not viable and it requires immediate medical attention. So symptoms of an ectopic pregnancy include severe abdominal pain, vaginal bleeding, dizziness, or fainting if internal bleeding occurs. So risks include previous ectopic pregnancies, pelvic inflammatory disease or PID, endometriosis, and smoking. Placenta previa occurs when the placenta implants too low in the uterus and partially or completely covers the cervical opening. And this can cause complications during labor and delivery as the baby exit is blocked. So symptoms include painless vaginal bleeding in the second or third trimester. If the placenta does not move as the uterus grows, then a C-section may be required. Then abruptio placentae is a medical emergency where the placenta separates from the uterine wall before delivery. And this condition cuts off the oxygen and nutrient supply to the baby and causes severe bleeding in the mother. So symptoms are sudden abdominal pain, heavy vaginal bleeding, and fetal distress, which is decreased movement. So risk factors are high blood pressure, trauma such as car accidents, or smoking or drug use. This condition does require immediate medical intervention, often through an emergency C-section to save the baby. So preeclampsia is a serious pregnancy-related condition that's characterized by high blood pressure or hypertension, protein in the urine, or it's all swelling, which is called edema. So if left untreated, it can progress to a life-threatening condition called eclampsia. So understanding those warning signs and risks is crucial for maternal and fetal health. So preeclampsia is a type of toxemia of pregnancy, which means that it involves toxic substances in the blood that affect circulation and organ function. It usually develops after the 20th week of pregnancy and can occur in first-time mothers, women carrying multiples, or those with pre-existing conditions. So symptoms of preeclampsia include high blood pressure, which is 140/90, protein in the urine, which is a sign of kidney dysfunction, swelling or edema, especially in the face, hands, and feet, severe headaches and vision problems, and rapid weight gain due to fluid retention. If preeclampsia worsens, it can develop into eclampsia, which is a severe condition that causes seizures, strokes, organ failure, and even death. Complications can include reduced blood flow to the placenta, leading to fetal growth restrictions or stillbirth, placental abruption, which is detachment of the placenta from the uterus, which can cause severe bleeding, and then multiple organ damage in the mother, affecting liver, kidneys, and the brain. So eclampsia is life-threatening and it requires immediate medical intervention. And early detection through prenatal checkups is crucial. Doctors monitor blood pressure, urine protein levels, and symptoms. So pregnancy doesn't always result in a healthy birth. In some cases, complications can lead to fetal death or congenital conditions such as birth defects. So this slide covers those differences between miscarriage, stillbirth, and congenital abnormalities. So with miscarriage or spontaneous abortion, it's defined as the loss of a pregnancy before 20 weeks or when the fetus weighs less than 500 grams. It occurs in about 10 to 20% of known pregnancies and is usually caused by chromosomal abnormalities, infections, or maternal health conditions. Stillbirth is defined as the loss of a fetus after 20 weeks of pregnancy. Causes may include placental problems, umbilical cord complications, infections, or maternal conditions like high blood pressure or diabetes. Congenital conditions are development problems present present at birth. So they can be inherited, which is congenital abnormalities that's passed down from parents through genetic mutations like Down syndrome or cystic fibrosis. Can be acquired, which is called by teratogens, which are those harmful agents that interfere with normal development. And then common teratogens again include alcohol, which can cause fetal alcohol syndrome, including leading to brain and facial abnormalities. Viruses like rubella or Zika can result in deafness, blindness, and brain damage. Drugs like prescription or illegal drugs. Some medications like Accutane can cause severe birth defects. And then radiation and toxins. So exposure to high doses of radiation or chemicals can disrupt fetal growth. After childbirth, a mother's body goes through significant changes as it recovers from pregnancy and delivery. However, some complications can arise during the postpartum period, and this affects the mother's health and the baby's nutrition. So this slide focuses on those two important conditions of peripural fever and lactation issues. So peripural fever is also known as postpartum infection, and it's a bacterial infection that occurs after childbirth. It usually results from unsanitary delivery conditions or retained placental tissue, allowing the bacteria to enter the uterus. If untreated, it can lead to septicemia, which is a blood infection, organ failure, and even death. Symptoms include high fever and chills, abdominal pain, foul-smelling vaginal discharge, and an increased heart rate. Risk factors are a cesarean section due to higher infection risk than vaginal births, prolonged labor or use of unsterile medical instruments, and retained placenta. So breastfeeding is essential for infant nutrition, but certain conditions can disrupt lactation and lead to feeding difficulties. So common postpartum lactation issues are anemia or malnutrition, and that can reduce milk supply. Hormonal imbalances, which affect milk production. Mastitis, which is a painful condition where breast tissue becomes inflamed or infected. Symptoms of mastitis include swollen red and tender breast tissue, fever, and flu-like symptoms, or painful breastfeeding. Causes of mastitis can be blocked milk ducts that causing milk buildup and bacterial growth, or bacteria entering the breast through cracked nipples. So breastfeeding is the ideal source of nutrition for newborns, but some mothers and babies experience challenges that make it difficult. And this slide covers those alternative feeding options and lactose intolerance in infants. So when a mother cannot breastfeed due to medical issues, low milk supply, or personal choice, some of the alternatives include a wet nurse, which is another nursing mother who provides breast milk for the baby, donor milk banks, which is pasteurized human milk from screen donors, and that's provided to infants in need, especially premature babies. And then infant formula, which is specifically designed breast milk substitutes that provide essential nutrients for those growth. So formula feeding is an alternative, but human breast milk does provide additional immune boosting properties that formula cannot fully replicate. Talking about like breastfeeding issues, we talked about last time how both my kids were born with the cleft soft palate. And because of that, they could not suck. Because there was that hole in the back of their throat. So we had to do bottle feeding with them. And so it was a combination of like just pumping breast milk and putting it in a specialized bottle that they wouldn't have to suck on the nipple. They would just use their tongue to press on the nipple to get the milk out because they couldn't suck. And then we would add formula to that as needed. Some babies are lactose intolerant, and that occurs when a baby lacks the enzyme lactase, which is needed to break down that lactose or the sugar in milk. So some symptoms of lactose intolerance include gas or bloating, diarrhea, or stomach cramps after feeding. It is pretty rare in newborns, but can develop later in infancy or childhood. So management of that is to switch to lactose-free formulas using soy-based or hypoallergenic formulas, or in mild cases, continue breastfeeding with a lactase enzyme supplement. So the postnatal period begins at birth and lasts until death. Unlike prenatal development, which has clearly defined stages, postnatal development is a continuous process with many physical and functional changes throughout life. So although we often divide postnatal life into stages of infancy, childhood, adolescence, and adulthood, they can be misleading because development is gradual and ongoing process. But early stage of life includes changes in size, proportion, function, and behavior. So, for example, a newborn has a relatively large head compared to the body. A child undergoes rapid brain growth and motor skill development. A teenager experiences puberty and hormonal changes, and then an adult continues to develop cognitively and physically, while aging process begins later in life. So growth and maturation occur at different rates depending on genetics, nutrition, and environmental influences. Some key postnatal growth patterns include, rapid growth in the first year of life with major milestones like walking and talking, skeletal and muscular growth throughout childhood and adolescence, development of sexual maturity during puberty, and then the gradual decline in physical function as aging progresses. So life expectancy has increased due to advances in medicine, but aging is still an inevitable process that we can't get around. All right, so the postnatal period is divided again into those four major life stages of infancy, childhood, adolescence, and adulthood, and older adulthood, when we're going to go into each one of those in depth. This is figure 24-11 in your book that just illustrates the developmental changes in body proportions. So you can note the dramatic differences in the head size. And as the individual grows, there's a gradual change in the relative proportions of the head, trunk, and limbs. And the head becomes proportionally smaller, and the legs become proportionately longer, and the trunk shorter. So the infancy stage lasts from birth to about 18 months and is a period of rapid physical and cognitive and physiological changes. This is when a newborn adapts to life outside the womb, developing essential survival skills. The first 4 weeks of life are known as the neonatal period, and that's a critical time for monitoring the baby's health. The stage focuses on adapting to life outside the womb with significant changes in breathing, circulation, and digestion. Neonatology is the medical field that specializes in the care and treatment of newborns, particularly premature or medically fragile babies. During pregnancy, the fetus depends entirely on the mother for oxygen and nutrients through the placenta. But at birth, the baby has to transition to independent breathing and circulation. So this involves closing fetal shunts, such as the ductus arteriosus and the foramen ovale, to redirect blood flow. So switching from placental to lung-based oxygenation, and the baby's heart must pump blood independently to all body organs. One of the most dramatic moments at birth is the baby's first breath. So, since the lungs were fluid-filled in the womb, the first breath is a deep and forceful inhalation to expand the airways. So, key respiratory changes at birth is when air replaces fluid in the lungs. Surfactant or substance that keeps the lung open is activated, and breathing becomes regular and independent. This is figure 24-12 in your book that shows a neonate. The umbilical cord has been cut, separating the neonate from the placental blood supply, which then requires the infant to breathe to get oxygen once supplied by the mother. So the first 18 months of life are a period of rapid growth and development. During this time, babies undergo major physical, motor, and neurological changes that prepare them for movement, communication, and interaction. Growth in infancy happens at an accelerated rate, more than at any other stage of life. Major growth milestones include birth weight doubles by 4 months and triples by 1 year. Body length increases by 50% by the end of the first year. By 15 months, the spinal curvature develops, helping with posture and movement. And these changes support the baby's increasing strength, coordination, and mobility. Motor skills progress from simple head control to complex movements like walking and running. Major motor milestones include raising the head by 3 months, which is strengthening the neck muscles, crawling by 10 months, which is developing upper and lower body coordination, standing alone by 12 months, which is preparing for independent movement, and running by 18 months, which is refining balance and coordination. So each baby develops at their own pace, but these milestones help to monitor normal growth. So both my kids were developmentally delayed. My son has autism. They've both been diagnosed with cerebral palsy. And so for like my son, he did not start crawling until 12 months, and he didn't start walking until 22 months, almost 24 months. So these were milestones that they weren't meeting, which triggered us to be able to start investigating on what might be going on with him and trying to get him the therapies and the supports that he might need, that then triggered us to get him tested for autism and cerebral palsy. So these are important milestones that your doctor and you should pay attention to. All right, so this is figure 24-13, which shows spinal curvature. So A is a normal rounded curvature of the vertebral column in an infant, and B is the normal vertebral curvature in a toddler. So the dark shadow emphasizes that distinct lumbar curvature that develops with the ability to walk. So childhood is the stage of life that extends from the end of infancy to puberty, and it lasts around age 13 years in girls and about 15 years in boys. And during this period, physical growth continues, motor skills improve, and significant developmental milestones occur. While the growth rate is still rapid, it slows down compared to infancy. So key growth characteristics are steady height and weight increase, body proportions become more balanced, muscle development continues, and it leads to greater strength and coordination. And then during childhood, fine and gross motor skills continue to develop further, allowing for more complex movements. So motor skill advancements include running, jumping, climbing with better balance, improved hand-eye coordination for activities like drawing and writing, mastering skills like riding a bike, catching a ball, and using tools like scissors or utensils. And these improvements enhance independence and social participation. When we start to talk about the teeth, primary teeth or deciduous teeth begin to fall out around age 6 or 7 and make way for those permanent teeth. Dental changes are important because they affect chewing and speech development, and good oral hygiene habits should start early to prevent those cavities and dental issues. Adolescence is the transition period between childhood and adulthood, and it typically ranges from ages 13 to 19. And this stage is characterized by rapid physical growth, hormonal changes, and the development of sexual maturity. During the adolescence, the body undergoes rapid changes due to increased hormone production. A significant growth Key growth milestones include a significant growth spurt. For girls, that's typically starts around age 10, while boys start around age 12. Increase in muscle mass in boys and body fat distribution changes in girls. The development of secondary sex characteristics like the growth of facial and body hair, which is more pronounced in males, development of breasts in females, deepening of the voice in males, and widening of the hips in females. And hormones play a crucial role in puberty with regulating growth and development. And some of the key hormones involved in adolescence are testosterone in males, which increases the muscle mass, deepens the voice, and stimulates the hair growth. Estrogen and progesterone in females, which promotes breast development, regulating the menstrual cycle, and influence fat distribution. And then growth hormone, which is responsible for height increases and bone growth. And adolescence is not just about physical growth, it also involves cognitive, emotional, and social development. And key changes include developing abstract thinking and decision-making skills, increased self-awareness and independence, stronger peer relationships and social interactions, and emotional fluctuations due to those hormone changes. And if you're in my psychology class, a lot of this will be familiar because we did talk about many of these things in some of the chapters in psychology this semester. So figure 24-14 shows growth in height. So it shows the typical patterns of gain in height to adulthood for girls and boys. So girls are the purple and boys are the pink. So you'll note the rapid gain in height during the first few years, and then a period of slower growth, and then another burst of growth during adolescence, and then finally ending during the beginning of adulthood. So adulthood is a stage where growth stabilizes and the body focuses on maintaining existing tissues rather than rapid development. However, degenerative processes also begin, and that marks the gradual transition towards aging. So in adulthood, the growth plates and bones fully close, meaning the bones no longer lengthen. Another anatomical structures such as the sinuses complete their development and settle into their final adult positions. And by this stage, the body has reached its peak physical strength and organ function, usually in the 20s and early 30s. Unlike adolescence, where new growth dominates, in adulthood, it focuses on maintaining and repairing those tissues. So key characteristics of adulthood include stable muscle mass and bone density in early adulthood, peak cognitive function and problem-solving abilities, gradual metabolic slowdown leading to increased fat storage if not managed with diet and exercise. However, those degenerative changes begin, it leads to loss of collagen and elasticity in the skin. So you start to get more wrinkles, gradual decline in organ efficiency, so slower digestion and lower lung capacity, and decreased muscle mass and bone density after the age of 30. And as adulthood progresses, cell regeneration slows down, and that leads to signs of aging. So some of the common changes include reduced ability to repair injuries quickly, declining immune system function, increased risk of chronic diseases like heart disease, diabetes, and osteoporosis. So I saw a funny little video on Facebook the other day where it's talking about how you climb up on a chair to get something up high. And when you're in your 20s and maybe early 30s, you would never second guess or even give a thought to it. You would just jump down off the chair and be fine. Once you hit your 40s and higher, you second guess that. And now when you're up on that chair, you put your hands on the chair, you step down 1 foot at a time, make sure you got your balance, and then let go of the chair. There's definitely no jumping off the chair. You just know you're going to hurt yourself in some way. So it definitely changes once you get closer to your 40s, you start to feel it. So older adulthood, also known as senescence, is characterized by degenerative changes, so in every organ system of the body. While aging is a natural process, its effects vary based on genetics, lifestyle, and environmental factors. So aging is a progressive process that affects all body systems, leading to gradual decline in function. Common degenerative changes include musculoskeletal system, which is decreased bone density, which is osteoporosis, and muscle loss, which is sarcopenia. Cardiovascular system, which is reduced heart efficiency or increased risk of heart disease. Nervous system, which is slower reflexes, memory decline, and increased risk of neurodegenerative diseases like Alzheimer's. Immune system, it has the weakened ability to fight infections, and sensory changes, so hearing and vision loss. As you get older, they talk about you're going to need to get reading glasses because your eyes just don't work the same, or especially, hearing changes. We use a lot of really high pitch frequency instruments in dentistry, and that can accelerate that hearing loss as well. Scientists have proposed several mechanisms to explain why aging occurs. Two of the major theories include the genetic theory of aging, which suggests that cellular aging is programmed into our DNA and follows a biological timeline. And then the other one is free radical theory of aging, which proposes that oxygen-free radicals or unstable molecules accumulate over time and cause cellular damage and speed up aging. The accumulation of these cellular damages leads to tissue deterioration and increases the risk of age-related diseases. So senescence refers to the gradual aging process that ultimately leads to death. And while aging cannot be stopped, healthy lifestyle choices can slow down degenerative effects and improve the quality of life. Again, factors that influence longevity include genetics, which is your family history of long life, that increases your lifespan potential. Diet and exercise, so a balanced diet, regular activity, slow aging, medical advances like detection of diseases, improved survival rates, and mental and social engagement. So staying socially and mentally active helps preserve brain function. Aging is a complex process influenced by, again, genetics, environmental factors, and cellular changes. And scientists have developed multiple theories to explain how and why the aging occurs. And we we talked a little bit about those. We introduced them on the last slide. But while no single theory fully explains the aging process, a combination of factors contributes to cellular and systemic decline over time. So free radicals are unstable molecules that cause oxidative stress and damage cells. And over time, cellular damage accumulates, and that leads to the wrinkles and organ decline and age-related diseases like cancer and Alzheimer's. Then antioxidants, which are found in fruits, vegetables, and vitamins, may help reduce free radical damage and slow aging. External factors like nutrition, injury, infections, exposure to toxins can accelerate aging as well. So, for example, poor diet, lack of exercise, increased risk of cardiovascular disease. Smoking and pollution exposure damage DNA and accelerate cellular aging. Chronic stress weakens the immune system and speeds up degenerative changes. So these factors show that lifestyle choices play a key role in how we age. And some researchers believe that certain viruses may remain dormant in the body and contribute to aging. So age-related cellular changes could include telomere shortening, which is protective caps on chromosomes wear down with each cell division, eventually leading to cell death. DNA mutations, which damage accumulates over time, affecting gene function and reduced ability to repair cells, so which leads to increased susceptibility to disease. The genetic theory of aging suggests that aging genes are programmed into our DNA. And some genes regulate cell division and repair, but as we age, these processes slow down. And research on genetics and longevity suggests that some people are naturally predisposed to live longer based on their inherited genes. As we age, the skeletal system undergoes significant changes that affect bone strength, stability, and overall mobility. And these changes increase the risk of fractures, joint pain, and degenerative bone diseases. So aging leads to a gradual loss of bone density and mineral content. And key effects of aging on bones include reduced calcium absorption, which leads to weaker bones, changes in bone texture, which the bones become rougher and less smooth, altered bone shape, which can cause postural changes such as curving of the spine, osteopenia, which is mild bone loss, and osteoporosis, which is severe bone loss, are common in older adults. Oh. All right, so bone spurs or develop around joints as a response to wear and tear. So these bony growths can cause pain and stiffness in joints. They limit range and mobility and motion, and they contribute to conditions like arthritis. As the bones become porous and brittle, they are more likely to break under stress or injury. And common fracture sites in aging adults include hip fractures, which is a major health risk that can lead to long-term disability, wrist fractures, which often occur from falls, and then spinal compression fractures, which is caused by the weakened vertebrae. Osteoarthritis is a common joint disease that's associated with aging, and some of the characteristics are cartilage breakdown, which leads to pain, swelling, stiffness, joint inflammation, which reduces flexibility and function, and then commonly affects weight-bearing joints such as knees, hips, and spine. And regular exercise, weight management, and joint-friendly activities like swimming can help manage those symptoms. In this figure in your book, it's figure 24-15. It shows changes in older adulthood. The insights show proportion of remaining function in the organs of a person in late adulthood compared with that of a 20-year-old person. And these are averages, so many individuals experience different situations. So the into to integumentary system, it involves the skin, hair, and nails, and it undergoes significant changes with aging. And these changes impact appearance, texture, and overall skin health. As we age, the skin becomes thinner, drier, and less elastic, leading to wrinkles and sagging. So why does this happen? You get decreased collagen production. Collagen provides the structure and firmness to the skin. You have reduced elastin fibers, which the elastin allows skin to return to its shape after stretching. Then you have loss of subcutaneous fat, which is fat under the skin, which provides cushioning and youthful volume. And then you have slower cell turnover. So the skin takes longer to heal and regenerate. Aging skin often develops pigmentation issues such as age spots, which they also call liver spots because they're dark patches that are caused by sun exposure over time. Uneven skin tone, which is due to changes in melanin or skin pigmentation production, and increased sensitivity. So the skin becomes more fragile and prone to bruising. Hair follicles shrink with age, leading to thinning and gradual hair loss. And common age-related hair changes include reduced melanin production, which leads to gray or white hair, hair thinning, which affects both men and women, but is more noticeable in men, and then slower hair growth. So the hair cycles become less active over time. And then although aging is inevitable, certain habits can help slow visible changes. So staying hydrated prevents excessive dryness. Moisturizing regularly helps maintain skin elasticity. And then eating nutrient-rich diets like foods and high in vitamin A, C, and E promote health, skin health, and then avoiding smoking. And as people age, the central nervous system, or the CNS, undergoes significant changes that affect memory, cognitive function, and emotional health. While some degree of cognitive decline is normal, aging can also increase the risk of neurodegenerative diseases and mental health conditions. So mild forgetfulness is a normal part of aging, but significant memory decline may indicate dementia. And some key changes in brain function include slower processing speeds, which tasks take longer to complete, reduced neurotransmitter production, which affects mood and cognition, and hippocampus shrinkage, which impacts memory and learning. Dementia is a broad term for severe cognitive decline, with Alzheimer's disease being the most common. If anybody knows somebody who has dementia or Alzheimer's, it's very hard to witness. My grandma has this, and every time we go to meet her, she's asking the same questions. She's doesn't remember a lot of things. She'll ask, "Oh, how old are my kids?" And I'll tell her, and then 1 minute later, she's like, "Oh, how old are they now?" And I'll tell her, and 1 minute later, she's asking again. Or, my mom and dad have been divorced for many years, at least, going on 15, 20 years, and she'll still ask, "Oh, how's your mom doing?" And think that they're still together. So it can be very difficult to see this occur to your family members. But aging increases the risk of degenerative brain disorders that affect mobility, memory, and function. And some common age-related nervous system disorders are Alzheimer's, which is that progressive memory loss and cognitive decline. Parkinson's disease is a movement disorder caused by reduced dopamine levels, have higher stroke risk because of decreased circulation and arterial blockages. And then peripheral neuropathy, which is nerve damage that causes tingling or numbness and weakness. Depression is also common in older adults, often due to social isolation, loss of family and friends, or independence, chronic illness, such as health conditions affecting daily life, and chemical imbalances due to decreased serotonin and dopamine affect mood. Symptoms of depression in aging individuals include persistent sadness or anxiety, fatigue and loss of interest in activities, and sleep disturbances and appetite changes. And although aging affects the CNS, certain lifestyle choices can help to maintain that cognitive function. So ways to promote brain health include mental stimulation, so reading, puzzles, lifelong learning, physical exercise, which improves blood flow to the brain, social engagement, which prevents isolation and supports emotional health, and healthy diet. So foods rich in omega-3s, antioxidants, and vitamins to help support brain function. The special senses, such as vision, hearing, taste, smell, and touch, they gradually decline with age and affecting daily activities and quality of life. These changes result from the natural aging of the sensory organs and the nervous system processing. So all special senses weaken over time due to reduced nerve sensitivity. You have fewer sensory receptors that send weaker signals to the brain, slower nerve conduction, which is the brain takes longer to process sensory input, and tissue degeneration. So structural changes in the sensory organs lead to that functional decline. Presbyopia is old eye syndrome, and that's when the eye's lens becomes less flexible and harder, making it difficult to focus on nearby objects. And most people experience farsightedness, which is difficult seeing close objects by age 45. And reading glasses or bifocals are commonly needed to correct this condition. Cataracts is the clouding of the eye lens, and over time, lens loses transparency and it leads to blurry vision. Cataracts are one of the most common age-related vision disorders, and surgery can replace the clouded lens with an artificial one to restore that vision. And then as your vision declines, older adults may experience difficulty reading, driving, or recognizing faces, increased risk of falls due to poor depth perception, and greater sensitivity to bright lights and glares. In addition to vision changes, aging affects hearing, taste, and smell, and it can impact how older adults interact with their environment and experience daily life. Some of these sensory declines can contribute to isolation, communication difficulties, and nutritional concerns. So presbycusis, which is age-related hearing loss, is a common in older adults and results from loss of the hair cells in the inner ear, which leads to difficulty hearing high-frequency sounds, such as consonants in speech, decreased elasticity of the eardrum, which affects sound wave transmission, and stiffening of the small ear bones or the ossicles that reduce ability to hear low volume sounds. So as a result, older adults may struggle to hear conversations in noisy environments. They need to increase TV or radio volume, or they misinterpret words due to loss of high-pitched sounds. Glaucoma is a condition where increased eye pressure damages the optic nerve and it leads to blindness if untreated. Early signs of glaucoma include gradual loss of peripheral or side vision, difficulty adjusting to dim light, and increased eye pressure during checkups. So regular eye exams and early treatment can prevent that vision loss. The ability to taste and smell decreases with age, and that affects appetite and food enjoyment. So by age 75, only about 40% of taste buds remain functional. Reduced sense of smell makes it harder to detect flavors and odors, and medications and illnesses can further dull taste perception. Um, Effects of this reduced taste and smell include decreased appetite and poor nutrition, inability to detect spoiled food or gas leaks, so there's safety concerns, and then increased preference for salty or sweet foods, which can lead to health risks like hypertension. The cardiovascular system undergoes significant changes with aging, increasing the risk of heart disease, high blood pressure, and circulation problems. Since the heart and blood vessels play a critical role in delivering oxygen and nutrients throughout the body, their decline can affect overall health and longevity. So, heart disease is one of the leading causes of death in older adults, and aging leads to weaker heart muscles and less efficient blood circulation. Risk factors for cardiovascular disease include high blood pressure, hypertension, high cholesterol levels, sedentary lifestyle and obesity, and diabetes and smoking. Atherosclerosis, it occurs when fatty plaques build up inside the arteries and reduce the blood flow. So effects of atherosclerosis is narrowed arteries, reduced oxygen delivery to the organs, coronary artery disease, which can cause heart attacks if blood flow to the heart is blocked, and peripheral artery disease, which can lead to pain, numbness, and slow wound healing in the legs. With age, arteries lose flexibility, and that makes it harder for the blood to flow efficiently. And so, with the effects of atherosclerosis can increase the risk of stroke if blood vessels in the brain ruptures, a higher chance of high blood pressure, which strains the heart, and then poor circulation, which can lead to cold hands and feet or slow healing of wounds. Hypertension is extremely common in older adults and increases the risk of heart attacks and heart failure, kidney damage from the increased blood pressure in the kidneys, and stroke due to pressure on weak blood vessels in the brain. So ways to manage blood pressure include eating, low sodium, heart healthy diets, rich in fruits, vegetables, whole grains, regular exercise, managing stress, and medications. The respiratory system undergoes several changes with aging that affects lung function and oxygen exchange. And these changes can lead to shortness of breath, reduced lung capacity, and increased susceptibility to respiratory illness. Understanding these effects can help in maintaining better lung health and overall well-being. As people age, the cartilage between the ribs or the costal cartridges hardens or calcifies, and this reduces rib cage flexibility, making it harder for the lungs to expand fully. And over time, this can cause barrel chest, which is a condition where the rib cage remains in an expanded position, and that reduces efficient breathing. Aging weakens the diaphragm and intercostal muscles, making breathing less efficient. With weaker muscles, older adults take slower breaths, which leads to reduced oxygen intake and lower endurance. It's more difficult clearing mucus, so it increases the risk of lung infections. There's a higher risk of developing chronic respiratory conditions such as chronic obstructive pulmonary disease or COPD. In the lungs, oxygen must pass from those tiny air sacs or the alveoli into the bloodstream. And with aging, the respiratory membrane thickens, and so that slows the oxygen transfer to the blood. And that can lead to shortness of breath during physical activity, fatigue due to lower oxygen supply, and a higher risk of respiratory infections such as pneumonia. All right, the urinary system, which includes kidneys, bladder, and urethra, uh, it plays an important role in removing waste, balancing fluids, and regulating blood pressure. So as we age, these functions decline, and it leads to reduced kidney efficiency, bladder problems, and increased risk of infections. So the kidneys contain millions of tiny filtering units called nephrons, Nephrons. By age 75, the number of these nephrons decreases by 50%, which reduces the kidney's ability to filter waste from the blood, maintain proper fluid and electrolyte balance, and regulate blood pressure efficiently or effectively. And so as a result, older adults may be at higher risk for dehydration due to inefficient water retention. They may experience high blood pressure as kidney function declines and have a harder time clearing medications that could lead to potential toxicity. Aging leads to narrowing of blood vessels, which reduce kidney blood flow by up to 50% by age 80. And this slows urine production, which can result in increased toxin buildup in the blood, higher risk of kidney stones due to concentrated urine, and greater likelihood of urinary tract infections. The muscles in the bladder wall weaken with age, and that can lead to incomplete emptying of the bladder, which can cause urinary retention, frequent urination or urgency, especially at night, which is called nocturia. Higher risk of incontinence, which is loss of bladder control, particularly in postmenopausal women and men with enlarged prostates. Bladder infections or UTIs become more common due to the weakened immune response in older adults, incomplete bladder emptying, which allows bacteria to grow, and decreased estrogen levels in women, making their urethra more susceptible to infections. The reproductive system undergoes significant changes with aging, affecting both sexual function and fertility, and these changes differ between men and women, and they're influenced by hormonal shifts, physical changes, and overall health. As men age, the ability to achieve and maintain an erection becomes more difficult due to decreased testosterone levels, which regulate libido and function, reduced blood flow to the penis, affecting erectile strength, and then longer recovery time between sexual activities. And the urgency for sex may decline, but sexual activity can continue with proper health management. With women, aging leads to lower estrogen levels, which can cause reduced vaginal lubrication, leading to discomfort during intercourse, thinning of vaginal walls, making them more fragile, and then changes in sexual desire, which is influenced by hormonal and psychological factors. The reproductive system undergoes significant changes with aging. Um, sorry, I lost my place here. Okay. All right. So women experience menopause, which marks the end of reproductive ability between the ages of 45 and 60. And menopause symptoms can include hot flashes, which is sudden temperature changes, mood swings, and sleep disturbances, bone density lost, in higher risk of osteoporosis, weight gain due to slower metabolism. Hormone replacement therapy can help to manage these severe symptoms. All right, so this week there is no quiz, so just study this material and be ready for your final exam. I did put the study guide in week 15's folder, and then you can let me know in your muddiest points if you have any questions about the material we went over today.